Hello everyone. This video is about semi-solid preparation by Monisha J, Department of Pharmaceutics, SPS Vistas. Introduction. Semi-solid preparations are the products which is applied over the skin or accessible mucous membrane to treat the skin or protects against harmful environment. They have physical properties such as smooth texture, non-greasy applications, easy applicable, high aqueous washability, physiological properties such as non-irritating and do not alter mucous function. Definition of semi-solids. Semi-solids are the topical dosage form used for the therapeutic, protective, or cosmetic function. They may be applied to the skin or used nasally, vaginally, or rectally. They are classified into two types. One is internal use, another one is external use. Internal use is applied inside a body, example gels and jellies. External use is classified into three types again. One is ointment, paste, and suppositories. Ointment usually will be in oleaginous base. Factors affecting drug absorption. One is skin hydration, second one is diffusion coefficient, third one is drug concentration, fourth one is partition coefficient, and fifth one is molecular size. Factors affecting absorption of drugs. Skin hydration. In contact with water, the permeability of skin increases significantly. So hydration is very important. Second one, diffusion coefficient. Penetration of drug depends on the diffusion concentration of the drug. At constant temperature, the diffusion coefficient of the drugs depends on the properties of the drug, diffusion medium, and interaction between them. Third one, drug concentration. The flux is fourth, partition coefficient. Drugs with low K value will not be permitted here. Drugs with high K value are not ready to leave the lipid portion of the skin. Optimal partition coefficient is required for good action. Fifth one, molecular size and shape. Drug absorption is inversely related to the molecular weight. Small molecules penetrate faster than the ointments. Ointments is a semi-solid greasy substance used to treat skin infections applied on mucous membrane or skin. Purpose of ointments are usually to heal the skin, such as wounds, burns, rashes, and scrapes. Composition of ointments are usually made up of fats, waxes, oils, and hydrocarbons. Application of ointments applied generally topical to the skin can appear stiff when applied. Viscous, semi-solid emulsion with opaque appearance and contrasted with translucent oil. Generally, they appear in water oil emulsion or oil water emulsion. Oil in water creams are more comfortable, cosmetically accepted as they are less greasy and more easily washed off using water. Gels and jellies. Gels are semi solid systems in which liquid phase is constrained with 3D polymetric matrix having high degree of physical or chemical cross linking. Gels and jellies. Gels are semi solid systems in which liquid phase is constrained with 3D polymetric matrix having high degree of physical or chemical cross linking. Coming on to the next topic, Skin structure and function. Human skin is highly complex, multi-layered structure and it represents the large organ of the body comprised of 10% of the human body mass. The skin layers include the epidermis, the dermis, the subcutaneous fatty layer. The barrier prevents the entry of chemicals, microorganisms, UV radiation and loss of water from the body fluids. In addition, the skin plays a role of skin. Structure of skin includes dermis, which has stratum corneum, stratum granulosum, stratum spinosum, stratum basal. Dermis, sweat duct, subcutaneous gland, sweat gland, erector pili muscle, hair follicle. Subcutaneous tissue, bloods and fat lobules. Skin structure and function. The epidermis is the outer vascular layer of the skin. It's a multi-layered region that varies in thickness of 0.8 mm on palms or the hands and soles, feet 0.6 mm on eyelids. Stratum corneum, usually called as a horny layer. The stratum corneum is composed of 80% of protein and 20% of the lipid. Next topic is drug transport and permeation through the skin. When the drug is applied topically, the drug diffuses out of its vehicle into the surface of the skin. The drug molecules have three routes to traverse the intact stratum corneum depending on the physiochemical properties. Next topic is drug transport and permeation through the skin. When the drug is applied topically, the drug diffuses out of its vehicle into the surface of the skin. The drug molecules have three routes to traverse the intact stratum corneum depending on the physiochemical properties. Drug transport and permeation through the skin. The intracellular pathways provides a polar route for the diffusion of hydrophilic molecules. However, the corneocytes are bound to a lipid envelopes that connect the lipid bilayer which need to be crossed. The appendages include hair follicle, sebaceous glands, sweat glands, which are provided as pores that overcome the stratum corneum barrier. This route factors affecting skin penetration. The rate and extent of the drug that penetrate the skin depends on the physiochemical property. Example, molecular weight, partition coefficient, lipid solubility, aqueous solubility. Number 2, vehicle and concentration of the drug in the vehicle. Number 3, skin condition. Tubes, which is a collapsible tubes. The tubes are generally first tested for the compatibility and stability intended for the product. Ointment tubes are generally coated with epoxy resin to eliminate the interaction between the contents of the tubes. Semi-solid must be stored in well-closed containers to protect against contamination and now we are going to see about ointment bases. Ointment bases may be used for the different physical effects or as vehicles. They include hydrocarbon base, which is oleaginous base. Next one, absorption base, water removable base, water soluble base. Hydrocarbon base. Hydrocarbon base are generally termed as oleaginous base. On application to the skin, they have emollient effect, protected against the escape of moisture, effective as occlusive dressing and can remain on the skin for prolonged periods of time. Water and aqueous preparation may be incorporated into them, but only in small amounts. Petroleum, white ointment, yellow ointment. Petroleum. is a purified mixture of semi-solid hydrocarbons obtained from the petroleum. It is melted between 38 to 60 degrees Celsius and combined with other agents such as ointment base. Next is yellow ointment. Usually has yellow wax 50 grams, petroleum 950 grams. White ointment differs from yellow ointment by substituting white wax, bleached and purified yellow wax. Adsorption base. They permit the incorporation of aqueous solution resulting in the formation of water oil emulsion. Example hydrophilic petroleum. Removable bases are oil water emulsion resembling creams in appearance because the external face of the emulsion is aqueous. They are easily washable from the skin and are often called as water washable bases. Usually include hydrophilic ointment, which has methyl paraben 0.25 grams, propyl paraben 0.15 grams, sodium lauryl sulfate 10 grams, propylene glycol bases. Usually, hydrophilic petroleum consists of 30 grams of cholesterol, stearyl alcohol 30 grams, white wax 80 grams, 860 grams of white petroleum. It is prepared by melting stearyl alcohol and the white wax on steam bath, adding cholesterol while stirring, dissolved, and adding white petroleum, allowing the mixture to cool. Next one is lanolin. Lanolin is obtained from the wool of sheep. It is a purified black wax-like substance which has been cleaned. Preparation of ointments. Generally, two methods are involved in this. One is incorporation method. In incorporation method, the solid in the oleaginous base, the components are mixed until a uniform preparation is attained. On a small scale, the pharmacist may mix the components using a mortar and pestle. While using liquids, the liquid substances, a solution of the drugs, are added to the ointments according to the ointment's base capacity. For example, very small amount of the aqueous. Jellies. Jellies can be defined as a semi-solid preparation that are transparent, translucent, non-greasy, intended for internal and external application. Jellies are classified into three types. One is medicated jellies, which is chiefly used on the mucous membrane of the skin. Due to the spermicidal, local anesthetic, and antiseptic property, jellies contain sufficient water. Next is lubrication jellies. They are generally used for lubrication. Advantages of jellies: administered easily, delivery of therapeutic agent to systemic circulation, facilitate rapid absorption of the drug, more convenient for disabled bedridden patient travelers, cost effective. Disadvantages of jelly: their stability and problem of dose measurement. Excipients of jelly and jellies. A gelling agent, example tragogan, gelatin, xanthan gum, gellan gum, cangenous, gar gum, sodium alginate. Stabilizer, polyethylene glycol, sorbitol. Preservative, methyl and propyl paraben. Preparation of jellies. Generally, molding method is involved in it. Compression, hand rolling, shaping. Preparation by molding, melting of the base, incorporation of the medicaments, pouring into the mold, allowing it to the cool, and congeal into a suppositories. Thank you so much for watching this video. Subscribe and give a like.